My name is David Crawford. I live at 36 Marlborough Street in Keene. I just found out that there's two different laws cover. There's a state statute and the city ordinance, and it sounds like maybe that we could repeal this ordinance, and the state, we'll deal with the state laws at another time, but it's not one concern. But so I don't know. I do want to say that if the marijuana decrim thing that I put forward is considered and accepted and gone, it got done. Well then, this is like a corollary to that. So I think this could definitely be done also. This could be done immediately, it seems, and really show that we are moving forward in that area. So, that's all I got. I do appreciate your time. Thank you.
Anyone else from the public like to speak? Please.
Linda Rubin, 610 West Street, Keene. I believe I sent a letter to you and the city manager on behalf of Hilton and Adnot. I forget if I got it, but I'd like to read that letter.
Please.
For everyone else here. So dear Councilor Richard, marijuana is the most commonly used illicit drug in the United States, with nearly 17 million Americans aged 12 and older reporting past use, and 374,000 people entering an emergency room annually with a primary marijuana problem. The downward trend in youth marijuana use during the late 1990s has ended. According to the Centers for Disease Control and Prevention's Youth Risk Behavior Surveillance System survey, past month marijuana use among high school students in the Monadnock region climbed to 32% in 2005 and has hovered around 30% since then. More teenagers are now current past month smokers of marijuana than of cigarettes, which is 18%, according to this biannual survey data. Not surprisingly, this increase coincides with a softening of youth attitudes about the risks of marijuana. Among high school students in the Monadnock region, the perception of great risk in smoking marijuana once a month declined from 2005, which was at 53%, to 2009, which is 49%. The Obama administration continues to reiterate its firm opposition to any form of drug legalization, including marijuana decriminalization efforts. Together with federal partners and state and local officials, the Office of National Drug Control Policy is working to reduce the use of marijuana and other illicit drugs through the development of strategies that fully integrate the principles of prevention, treatment, recovery, and effective supply reduction efforts. Proposals such as decriminalization, or in this case, removing ordinances about paraphernalia that would promote marijuana use, are consistent with this public health and safety approach and out of alignment with the total population health outcomes of the Healthy Monadnock 2020 initiative, which the city of Keene and many other towns in the Monadnock region have engaged in. In Keene's debate over decriminalization, many troubling misperceptions are gaining currency. It is critical these false assumptions be addressed and clarified using the best evidence available. Careful examination of the facts by the Office of National Drug Control Policy and the National Institute of Drug Addiction leads to the following conclusions about the dangers of marijuana use and the likely consequences associated with decriminalization. One, that marijuana use is harmful and should be discouraged. Marijuana use is associated with dependence, respiratory and mental illness, poor motor performance, and impaired cognitive and immune system functioning, among other negative effects. In 2009, among marijuana users 12 and older, 4.3 million had a marijuana abuse or addiction problem. Research shows that approximately 9%, or about 1 in 11, of those who use marijuana at least once will become addicted. This rate increases to 16%, or about 1 in 6 if you start in your teens, and goes up to 25 to 50% among daily users. Regular marijuana use by young people can have long-lasting negative impact on the structure and function of their brain, negatively affecting those areas responsible for memory and learning and increasing the likelihood of young people dropping out of school. Marijuana use amongst workers is associated with increased absences, tardiness, accidents, workers' compensation claims, and job turnover. The amount of THC in marijuana samples confiscated by police has been increasing steadily over the past few decades. In 2009, THC concentrations in marijuana averaged close to 10%, compared to around 4% in the 1980s. For a new user, this may mean exposure to higher concentrations of THC with a greater chance of an adverse or unpredictable reaction. Marijuana intoxication can cause distorted perceptions, difficulty in thinking and problem solving, and impaired judgment and motor coordination, which contributes to accidents while driving. A recent analysis of data from several studies found that marijuana use more than doubles a driver's risk of being in an accident. Further, the combination of marijuana and alcohol is worse than either substance alone with respect to driving impairment. Studies have shown an association between chronic marijuana use and increased rates of anxiety, depression, suicidal thoughts, and schizophrenia. Marijuana raises heart rate by 20 to 100% shortly after smoking. This effect can last up to 3 hours. Studies suggest that marijuana users may have a 5-fold increase in the risk of heart attack in the first hour after smoking the drug. Research has shown that marijuana smoke contains carcinogens and is an irritant to the lungs. Marijuana smoke, in fact, contains 50 to 70% more carcinogenic hydrocarbons than does tobacco smoke. 2, decriminalization will lead to lower prices, thereby increasing use. A recent report from the RAND Corporation called Altered State discusses how decriminalization and legalization would cause the price of marijuana to come down, triggering increases in the use of the drug. Illegality helps keep prices higher, and because drug use is sensitive to price, especially among young people, higher prices help keep us use rates relatively low. Use of the legal substances, alcohol and tobacco, far outpaces the use of marijuana, a strong indication that laws reduce the availability and acceptability of substances. Experience with even tightly regulated prescription drugs such as OxyContin shows that legalizing drugs widens availability and misuse even when controls are in place. As the Keene City Council debates whether or not to move forward the getting rid of this ordinance, I urge members to review the facts about marijuana use and its effects on the human brain and people's lives. Lots of sources for that, and I can certainly share more with the council if asked. There are many negative consequences associated with marijuana use that will all likelihood increase as a result of decriminalization. I hope that the City of Keene will remain committed to discouraging the use of marijuana by keeping all of our laws against its use strong and working with local substance abuse coalitions and schools to help citizens know and understand why these laws are important to uphold. A couple of other statistics that just came out, I just got them today actually, from a report that was done by the New Hampshire Charitable Foundation. In this state, in New Hampshire, the 12 to 17-year-old age group has rates of use of alcohol and marijuana that are ranked in the top 10 among the 50 states and the District of Columbia. We're the 3rd highest for regular alcohol use, 4th highest for regular binge drinking, and 2nd highest for regular marijuana use. The rate of alcohol or drug dependence among 12 to 17-year-olds in New Hampshire is 4th highest in all of the states. In New Hampshire, the young adult group, age group 18 to 25-year-olds, has rates of use of alcohol, marijuana, and prescription drugs that are ranked in the top 10 among the 50 states and the District of Columbia. We're 3rd highest for regular alcohol use, 5th highest for regular binge drinking, 5th highest for regular marijuana use, and 10th highest for prescription drug misuse. So anything that is put forth in front of this council to in any way make it easier for our young people to get access to marijuana, alcohol, or other drugs, prescription drugs, I do not feel would be, and I'm speaking personally as a citizen now, would be in the best interest of our young people. And as the director of Healthy Monadnock and championing with so many folks in this community our vision of becoming the healthiest community in the nation by the year 2020. I think it would be sad to see us taking a lead in the state towards anything that would look like decriminalizing any drug that has the kind of effects that the ones we're speaking of have on young people and older people in our community. Thank you.
Thank you. Anyone else from the audience?